My name is Jasmine Johnson, and I will be giving a focus assessment presentation based on a specific patient. The patient is a Caucasian male, age 65, who is currently married and has been married 3 times. The usual occupation of the patient was doing labor at the refrigeration factory. However, now they are retired, and from time to time they work driving a truck for a nearby company. Their usual source of medical care is the VA hospital. The patient's vital signs are as follows: blood pressure 130/80, pulse 74 beats per minute, temperature 96.9 degrees, respiratory rate 20 breaths per minute. Pain was rated at a 3 on a scale of 1 to 10. The client's chief complaint was a bump on his neck that made him disoriented. The patient was admitted on March 21st and noticed the bump on March 20th. Patient describes the bump as being the size of a nail on your pinky finger on the nape of their neck. They described the pain as being about a 50 on a scale of 1 to 10 on the day they were admitted to the hospital. Associated symptoms include the patient being unable to stand on their own, sweating more than usual, having problems seeing clearly, and not being able to breathe well. These symptoms greatly interfered with the client's daily activities. The client made no efforts to treat the bump and instead came straight to the hospital when they noticed the previously stated symptoms. Aggravating and/or precipitating factors were standing and walking around. Alleviating factors were resting and sitting. Patient had no childhood illness, up to date on all immunizations. They have no allergies or reactions to drugs. Their history of hospitalizations and surgeries include their appendix being removed as a result of appendicitis. The patient was also diagnosed with type 2 diabetes. Patient does not exercise much. They only walk places when required, such as to use the bathroom. The client only sleeps about 2 hours a day. The patient stated that they quit smoking, but they used to smoke 4 packs a day. They have also cut down their alcohol intake from 12 beers a day to 1 beer a week or less. They also no longer drink 1 to 10 cups of coffee a day. Client only eats fast food about twice a month, and they do not usually use safety devices. However, they use a seatbelt most of the time they are in a vehicle. Patient's mom died of lung cancer and was not a smoker. Their dad died of prostate cancer. Some of his siblings have diabetes and one has a colonoscopy bag. Their medications include cefazolin, which is an antibiotic to treat the infection in the bump on the patient's neck, heparin, which is a blood thinner and helps reduce the risk of clots in inactive patients, insulin aspart, which is a short-acting insulin used by diabetics before meals, insulin glargine, which is a long-acting insulin used to control diabetes, polyethylene glycol, which treats constipation, metoprolol, which is used to lower the patient's high blood pressure. The general review system is as follows. Patient describes their health as moderate and they're satisfied with it. Patient's weight and energy are stable. They don't experience fever, chills, night sweats, or excessive fatigue. The client generally has always felt hot and this causes them to sweat often. Integument review of systems is as follows. Given the patient's current health status, the integument system is a high priority to assess. There were no signs of extreme dryness, rashes, or itching. Patient expressed concern about the bump on the back of their neck. The patient no longer spends long periods of time in the sun and occasionally uses sunscreen. They have not noticed any changes in hair, nails, or skin, except for graying hair and some wrinkles from aging. Neurological review of systems is as follows. The patient has not experienced numbness, tingling, or burning. They did not have a seizure or loss of consciousness. They do experience insomnia and states that they only sleep about 2 hours a night. Ordinarily, the client doesn't experience any unsteadiness or loss of balance. However, the bump on the back of his neck, they were unsteady, imbalanced, and uncoordinated. Anxiety does not interfere with their speech. They have no difficulty with speech and no past history of a head injury. The patient has partial deafness in right ear and is nearsighted but experiences blurriness occasionally. The patient has neck pain and tenderness due to the bump on their neck. The integument exam, I observed no unusual size and shape of the patient's skull. I did not feel any bumps or lumps on the head. The skin of the face appeared to be in normal condition, color, and symmetry. Eyelids were of normal color and condition. Eyelashes were present and had a normal distribution. The conjunctiva, sclera, and cornea appeared normal and healthy. I could not see the entire iris, so their eyes were not bulging. I inspected lips, facial structure, buccal mucosa, teeth, gums, tongue, floor of mouth, hard and soft palate, and posterior pharyngeal wall, and there was nothing unusual or concerning about them. Patient had usual color, lesions, scars, and hair distribution on the skin of head, face, neck, chest, and extremities. There was a normal amount of flaking on scalp, even distribution of hair, and ordinary characteristics of lesions. The skin had a soft texture and symmetrical warmth on extremities. The patient had the normal amount of turgor for their age and had consistency in skin color. The lesions on the skin include moles that were asymmetrical, had a distinct border, were consistently one color, and were relatively small. No edema or moisture on skin were detected. The nails were light pink, with the exception of the light moon at the bottom of the nail. Capillary refill was less than 2 seconds. The nails were firmly adhered to the finger, and they were relatively thick. There was no abnormal shape or clubbing of the nails. For the neurological exam, I assessed the patient's mental status with a mini-mental state exam. They received a score of 25 out of 30. To assess gross motor function for lower extremities and balance, I had them walk heel to toe and walk on their toes. They were able to maintain balance and successfully complete the task. I performed the Romberg test, and the patient was able to balance. Therefore, they had negative Romberg. To assess upper extremity fine motor function, I had the patient hold their arms out with their eyes closed and move arms to touch their nose with their fingers. I had them do a series of rapid alternating movements, and I also had them touch their thumb to their fingers rapidly. The patient was able to maintain coordination and successfully complete the task. To assess lower extremity fine motor function, I had them take the heel of one foot and run it down the shin of the other leg. I had them repeat this on both sides. The patient successfully completed this task also. The patient was able to feel light touch, painful, and vibratory sensation. They could correctly tell me the position of their body parts. I evaluated the cortical and discriminatory sensation of the patient using stereognosis. The patient was able to feel, recognize, and name an object that I had placed in their hands, which tells me that this sensation is intact. The patient had negative Babinski reflex and did not show signs of ankylosing. Respiratory system is a pertinent system. Since the patient used to be a heavy smoker of about 4 packs a day, it is important to assess their respiratory system. The patient could have developed a number of respiratory diseases due to their heavy smoking and therefore weakened lungs. According to Nursing Times, the 2 most common respiratory diseases caused by smoking are lung cancer and chronic obstructive pulmonary disease. Smoking also precipitates asthma attacks and increases their severity. There is also evidence that indicates that the onset of asthma in adults may be induced by smoke exposure. Nursing Times also states that the risk of pneumonia is increased by the irritant effect of smoke inhalation, accompanied by mucous gland hypertrophy and damage to the immune system. Pneumonia is not only more common among smokers, but is also much more likely to be fatal. For these reasons, it is important to listen to breath sounds so that lung diseases and cancers can be detected early. Peripheral was also a pertinent system. Due to the patient's inactivity and prolonged periods spent in bed, it is important to assess their peripheral vascular system. It is also important to check for ulcers, sores, and infections on areas such as the feet, where diabetics tend to lose feeling. The World Health Organization states that it is known that immobility is one of the factors that may lead to the development of a blood clot in a deep vein or deep vein thrombosis. Prolonged immobility can lead to pooling of blood in legs, which could cause swelling, stiffness, and discomfort. Deep vein thrombosis can be life-threatening and deadly, so it is important for nurses to monitor the skin, capillary refill, and pulses of a patient. This concludes the focus assessment presentation.